A nurse-led company, LINOVA Health, and diabetes advocacy organization Fighting Diabetes are gravely concerned about the state of men's health in South Africa. The health and patient advocacy companies are encouraging men to treat their health as a priority. The founder of LINOVA, Dr. Lindele Mbanjwa, says it is a fact that men visit health facilities for routine health checkups less than women, and that health checkups among males needs to be taken more seriously. LINOVA has partnered with Fighting Diabetes medical specialists, GPs and allied workers in all the provinces to encourage men living with chronic illnesses to take their health seriously, improve the quality of life and increase their lifespan. Well, we've got Dr. Mbanjwa with us this morning, and let's have that conversation. Good to have you. Thanks so much for joining us.
Thank you so much for having me.
So, I mean, let's start off with this question. Why? Why do men not take their health as seriously as, say, women do?
Maybe I'll say it's because of the traditional backgrounds that go with it and the stigma. You know, men would always want to appear as strong, and they feel like that going to a healthcare facility or checking up on yourself is somehow being weak. So we are very much out there running awarenesses to say that we need more men, you know, to take accountability for their own health early, because the non-communicable diseases that they are dying from are highly preventable.
How do we encourage men to go for these checkups? Because, I mean, you're seeing that men in both rural and urban areas are exceptionally susceptible and vulnerable to developing non-communicable diseases because of the fact that they don't want to seek this healthcare. How do we encourage them to?
I'll say that in my many years of working as a nurse practitioner, many times you will find that men will be accompanying their partners, and when you ask them to come through, have a check yourself, you'll find that they are walking around as ticking time bombs. That blood pressure will be exceptionally very high. And when they see it, that, oh my word, I really need to do these checks early to prevent myself from complicating, then they have that understanding. So if the awareness could be out there, because as a country, South Africa, we've got the best in terms of treatments, and they are there to help our people. We are actually running out an awareness drive to say keeping you alive. So if more men can be aware that help is out there for them, they just need to make sure that they remove the stigma that is associated with going to a facility for a checkup early, and they start looking after themselves and making the right health decisions towards them living healthier lives. Because many times they will only go to the healthcare facilities only when they are sick. But now we want to turn the tables around and say, let us prevent instead of treating. So if we can prevent these non-communicable conditions from progressing and getting worse, we can do better.
Which is a fact. I mean, it is something very, very important. And if we look at, I'm going to get to mental health now, but I just want to focus on diabetes, and I want to focus on the heart issues. What are the other things that you find are, you know, predominantly focusing men and being a very, very big problem for men at the moment?
The strategic thing that we did was to partner up with Fighting Diabetes with Mr. Pito Molemane, and he is a type 1 diabetic, and he's able to have real-world statistics. You know, I've worked many years in the healthcare sector. We've published a lot of research around how to treat chronic conditions and what are the best treatments out there. But you'll find that if you don't have the reality of it, you know, real world scenarios, men tend to then run away. But having ambassadors around, you know, who are there, it assists them quite a lot. And going back to mentioning the rate of men that we are losing through suicide, it's also growing at quite an alarming rate. So as a country, it's high time that we plan and we make sure that our focus is on men, because we are losing the working population, and it will have a bad impact on our economy in the long run.
I mean, you certainly don't want an entire generation of men or women that are out there, and we've got diabetes, we've got high blood pressure, we've got strokes, heart attacks. I mean, all of these things, which if you go for regular checkups, and this is what we advocate for all the time, is that you can potentially get these harmful conditions under control or stop them before they start. I mean, these, I imagine, are some of the big things that you're trying to advocate for. Stop it before it gets bad.
And we are definitely saying, let us improve the quality of life. You can get to 65, you can get to 85 with all your limbs intact. You can still see a lot of renal dialysis units are packed with patients because of diabetes nephropathy, something that could have been prevented. And a lot of patients who come to us for care during the health education sessions with our nurses, they will definitely say, where were you guys? Had I known this earlier, I would have made life-changing decisions that would have prevented me from being here. So that is why we are encouraging people. By then, it's already too late. So we are encouraging people to say, once your doctor has diagnosed you with a chronic condition, make sure that you take a step further and you are seen by the multidisciplinary team, because it takes more than one person to look after a patient with a chronic condition. And our male participants need to understand that seeing a doctor alone is not enough. You need to be seen by a podiatrist, a nurse health educator. You need to be seen by a physiotherapist, a podiatrist. And I always make sure that all patients, they are seen by a podiatrist, a dietitian. It's a multidisciplinary approach that we need to start taking. And it's about time, because as South Africa, we have the best policies, best guideline. But despite all of that, we are still dying. The number of people dying from non-communicable condition is at an alarming high rate, and it's a public health concern.
It's a very big concern, and as we say, they can be avoidable if you keep checking up. The one thing I need to speak about, I know this isn't something that we've ignored because we've spoken quite a lot about it on the program, but I would like to touch on it again, is men's mental health, the mental health of men. As women, I'm not saying all women, but a lot of us love to talk. We love to speak about our problems. We like to address the fact that, things aren't right, and we speak to our friends and those that are close to us. But you find that men, for various reasons, and I think you put them in the beginning of the interview by talking about the fact that it's seen as being weak if you speak to these kind of things, or you don't speak to your friends about it. You speak to them rather about the soccer results. You want to speak about the fact that Kaizer Chiefs and Pirates are going to be in the finals, but you don't actually talk about the fact that you are going through something. What are we seeing trends with mental health for men?
A lot of time with men, they will hide behind their work. It's either they're spending more time at work, behind substance abuse. It's seen on the withdrawal symptoms. Also, because as an occupational health nurse practitioner, we see it a lot in the industries where there's high rates of absenteeism from work. They're taking time off sick, and it will always be Monday or Friday, so because of hangover. And now we are saying to men, it's high time that we change the landscapes. As much as they do seek for help, by the time that the family members are tired of their behaviors, it's the domestic violence that comes with it, and a whole lot more of other disorders that come with personality disorders, because of they are sitting, they are repressing what they are feeling, like they are bottling up their feelings instead of allowing themselves to talk about it. But we are happier now because of our approach in rural areas as well, where we have patient-focused support groups where men are coming up to start talking, and we would encourage even their partners to open up the playing fields and allow them to talk. So the withdrawal symptoms, being quiet, should be the first alarm to say there's something wrong with my brother or with my father.
And finally, as I let you go, traditional beliefs and views on sexual health as well. I mean, there's stories of obviously a lot of men refusing safe sex because of these beliefs, which leads to an increase in sexually transmitted diseases. Let's perhaps kind of get that as the closing point here on the program.
Well, also with most men, when they have these non-communicable diseases, chronic conditions, you'll find that they only approach their healthcare facilities when they are suffering with sexual dysfunctions, and then they know now, okay, we've got a problem, because maybe diabetes has progressed, and most of them as well, because of multi-partners and how we have lessened the health education when it comes to HIV and the awareness of it. A lot of them don't even know that even if you are HIV positive, you still need to continue condomizing, you still need to continue practicing safe sex. So that is why we have opened up these facilities for health education. We have teamed up with doctors, we've teamed up with psychologists, we've teamed up with also HIV counselors. It's a whole lot more team. That is why we are encouraging our South Africans to make sure that you reach out, and make sure that you are getting the help that you are supposed to be getting, because all the assistance is there. No one should be dying from opportunistic infections that are associated with HIV at this time of the year.
Right.
Not with the kinds of treatments that we have.
Absolutely. We have the treatment available. It needs to be used. Thank you. Thanks, Doc. Thanks for speaking to us. That's LINOVA founder, Dr. Lindele Mbanjwa, talking to us about the state of men's health in South Africa.